Good afternoon, everyone. My name is Selena Williams. I am the program manager here at GA-HITEC for the Medicaid program. Our objectives for today's webinar is to overview the security risk analysis requirements and to review and respond to frequently asked questions regarding the security risk analysis. I will be your moderator today for this webinar, and we also have Kelly M. Jolley and Liz Hansen. Kelly Jolley, Esquire, is a managing member and CEO of Compliance of Jolley Law Group, LLC. Kelly Jolley is a leader in the healthcare and legal communities and is a member of the Health Information Technology Practice Group of the American Health Lawyers Association. Mrs. Jolley also counsels healthcare providers, technology, vendors, and other business on the corporate compliance standards, best practices, and corporate governance matters, and on the potential collateral consequences of business decisions. So, Liz, can you please define the security risk analysis? Just kind of explain to us exactly what is security risk analysis.
I'd love to, Selena. I'm afraid if you keep talking, you're going to lose your voice. So we just as an overview, just wanted to review that the security assessment or the security risk analysis or the risk analysis, they're all the same activity. Is a comprehensive look at your organization's security structure, and that's in 3 different areas, that aims to uncover potential threats and vulnerabilities within the IT ecosystem. And to look at a security risk assessment, you have to look at the administrative functions within the practice, your HIPAA manuals, your HIPAA training, your policies and procedures, your security officer, etc. And so that's part of the administrative. The physical includes all the hardware and your network environment. And then the technical includes all your software applications or those interfaces or those applications or resources that will move EPHI. So all of that has to be taken into consideration when you perform your comprehensive look or risk assessment. When it comes to healthcare organizations, you have to look at the confidentiality, integrity, and availability of electronic protected health information held by the organization. And there are many pieces of guidance on the risk analysis, and Kelly's going to talk about some for us. Next slide.
Hey folks, so basically the way it works is all eligible professionals, and that means you know this from your MIPS and your used to be meaningful use, and your hospitals have to attest to promoting interoperability. And to do that, you have to conduct a security risk assessment to receive your incentive payments and to avoid monetary penalties like 25% of your MIPS score. You know, we talk about MIPS now, and the truth is, though, this has always been a requirement of all of those incentive payments since the beginning of meaningful use. So every so often I run into a provider who says, well, where did this come from? Or why did they come up with this? And they came up with this a long time ago. Sometimes, though, folks don't realize that this was actually already a requirement. It's already federal law. You already had to be doing it under the HIPAA rule. So particularly once HIPAA was pumped up, I call the HITEC Act from 2008, HIPAA on steroids. So under HIPAA, you are a security rule. You already have to do a security risk assessment. And that covers for all covered entities and all business associates, because business associates under HITEC are specifically and directly required to meet all the requirements of the security rule. So what does that mean? It's kind of like Liz just said. You have to conduct a risk analysis, and you have to have an annual security risk assessment. You have to be managing your risk. I always think about Catholic Healthcare Services from Philly in 2016. They settled for $650,000 with HHS. They're a management company, but HHS went in to look at how they handled a breach based on an employee losing a cell phone. And what they basically found was that they hadn't done the security risk analysis, and they hadn't implemented the security controls that Liz was just talking about, those physical, technical, and administrative safeguards. And that was really the sole basis of the fine. It wasn't the breach It's just the security risk analysis itself.
Wow. So that gives you, and along with that, we always remember, we've got to keep in mind that Kelly mentioned the amount in the $600,000 range, and it can get much higher. So we're going to talk about risk in a little while. We've got to remember that cost, that amount. So we did want to highlight something in regards to the security risk assessment and promoting interoperability. What we've given you here is the actual specification on doing the security risk assessment or the analysis for promoting interoperability on both the Medicaid and the Medicare side for both MIPS and Medicaid incentive program. And if you do not do the security risk assessment, you have to do it to state yes. So I'm not even going to talk about what happens if you said yes and you didn't do it. Okay, because that's fraud. All right, that's just wrong. But if you can't say yes to this question on either one of those attestations for MIPS or for Medicaid, you will fail this component. So you'd fail the entire Medicaid incentive program, and you would fail the 25% of promoting interoperability. So this is very, very important for us as far as MIPS, but it still doesn't, it doesn't do anything to shadow the fact that we've always had to do this, and those HIPAA violations could be even bigger fines.
Okay, so here's a couple of things that I think everyone has to keep in mind when they're doing this. One question I get a lot is that, well, Kelly, why can't you just tell me what CMS wants me to have? How come I don't just get a manual and a book or something, a HIPAA binder with all the things I need? And this quote here from DHHS, y'all all know that the Office for Civil Rights is who enforces HIPAA. Basically, what they say is that you, as a covered entity or business associate, should be able to implement whatever technologies and best practices are best for you. So in other words, it's put back on you to make the judgment. But they clarify that, or qualify it, I should say, by saying it has to be reasonable and appropriate. Okay? So what does that mean? What a lot of times folks don't understand is they think of the risk assessment as a requirement when it's really intended to be a tool. The risk assessment shows your analysis as a provider in how you see what risks you face and how you choose through technology or best practices to act to mitigate those risks, to ensure that you're protecting the confidentiality, integrity, and availability of your protected health information. Okay, and this applies to all information that you as a provider create, receive, maintain, or transmit. So what they do is they give you a law, but they leave it up to you to make the determination about how best to meet that law. What you're doing in your security risk assessment is showing your analysis and why you've made the decisions you've made. And if some of your decisions you acknowledge are limited, meaning that you had to make them because that's all the resources you had, that's where you'd list that. So it's actually in a CMS document. The feds always tell you actually what you have to do. This list right here is the first page of the security standards matrix that applies to all covered entities. So on the left, you see the standard. That section refers to the actual rule in the CFR where you have to find it. And then under the implementation, it tells you whether what it's looking for. And then the letters next to that tell you if it's required or addressable. And you'll note that we're looking right up here at the beginning. The risk analysis is the number one thing, and it's required. Risk management is required. A sanction policy for your employees, reviewing your system activity, all those things are required. So if you're, people will ask me, well, Kelly, how am I supposed to know? It's actually in the law, and here's this matrix lays it out. If you're looking for more information, you just go to that section there. Thanks. So based on that list, some of the things I find are common security mistakes just generally is that providers aren't properly handling their business associates. We all know that a business associate is any vendor or service provider that has regular and routine access to your protected health information based on the services they're providing you. So that includes your IT vendor, an analytics company, your cleaning company, if you have PHI out, your IT company, your lawyer. It might include whoever helps you with collections. All of those kind of folks are business associates. And you have to have a business associate agreement in place with each one of them. In both 2017 and 2018, for example, we saw enforcement action based on providers who used file fax, which was a way of transmitting patient records. Unfortunately, file fax didn't do a great job of getting business associate agreements signed. So every time any provider sent a file through file fax, and they didn't have a current business associate agreement in place, and this went on for years, each one of those transmissions was a violation of HIPAA and led to settlements. Both file fax and providers ended up settling. Other things you see, poor data security. They're not really encrypting data. Data encryption is not required, but the Office of Civil Rights takes the position if you've analyzed whether or not to encrypt and decided not to encrypt data on any portable device or laptop or phone, then your analysis is faulty. That's basically how they get around that. Not using current software. Had a very nice provider one time. She really didn't see why she couldn't use Windows XP, even though it was no longer supported. And that's an automatic violation. If you're not downloading your patches on a regular basis and your updates, that's an issue. Always problems with employees being terminated and no one checking to make sure that that employee's access was turned off. The internal audits are crucial, right? I think the idea is that if McDonald's can have someone sign the back of the bathroom door to show that someone cleaned that bathroom every day, you should be able to have someone in your practice check once a month or whatever to make sure only the right people are accessing your system. And then the last thing, backups are crucial. It's great to have a backup, everyone should, but you also need to be testing the backups and making sure that they are there. Data recovery means that you have a backup that you can actually use. Next.
Okay, Kelly, I know you gave us all that good information saying we must do this. You know, we're busy. So my question is, do we really have to? I mean, if we've done it last year, do I really have to do this again? There's several myths out there saying that you don't have to do it every year. So can you please explain that to us?
Yeah, sure. So it's a myth. You're right, Selena. It's just like they've got here on the Health IT website. The first is that small providers sometimes think that it's optional whether they meet certain HIPAA requirements. And the only thing your size impacts may be the depth and the expense that you go to in doing the analysis, but you must do the analysis. So every provider, no matter how big or how small, has to do a risk analysis. And like Liz said earlier, if you're receiving any incentive payments, you have to do the risk analysis. That doesn't mean you start from scratch every year. I mean, usually you're going to be starting from your analysis last year, but you do need a dated assessment for each year.
Thank you. Doesn't my IT guy or EMR vendor already do this for me?
Oh boy, both Kelly and I wanted to take a shot at this one because we feel so strongly about it. I can't tell you how many providers have told me over the last 10 years that either their IT vendor was doing it for them and they just needed a few more questions, they just needed a few more network things straightened out, or that their EHR vendor had already done it and so they didn't need to do it. So the likelihood that your EHR vendor is doing your security risk assessment properly, if they're doing it, is slim to none. There may be a few out there that have a compliance component to their business, and perhaps they're doing it properly. But please, earlier I mentioned that there was the administrative, the physical, and the technical. Your IT company is not going to know what your policies and procedures are, or it's not likely. And that is critical, that it addresses your policies and procedures. The other thing is that your EHR vendor isn't going to know about your policies and procedures, and they're not going to know about your IT functionality, and your IT company's not going to know about your EHR vendor. You are the person putting that information together, or your security officer, or a professional compliance individual. Kelly, do you want to speak a little bit about this while I take a break?
Yeah. The only thing that I would add, really, Liz, is that IT vendors primarily are concerned with systems because that's what they're in charge of. It's even more limited when you're dealing with your medical record service provider. They're only really concerned with your medical records. And there's a lot of great medical record companies out there, and they sell themselves as helping you do this or doing this for you. But CMS and the OCR have been very clear that if your security analysis only looks at your systems, then it is faulty. It is not a complete assessment. And just for example, we talked a little bit about business associates. Well, you have to do an inventory of all your EPHI as part of this, and that includes all data that your business associates have. And it's just not the case that your EMR vendor is going to have access to that information.
One of the other things I wanted to point out before we keep going, and I think we said this, but I just want to make this clear. They will tell you they can do it. That doesn't mean that they're doing it correctly. So please be cautious. There are attorneys out there that do it. There are consulting organizations that are out there doing it. There are IT companies that have compliance components that can do it. But just your straight up IT, please be cautious. Okay, Selena, sorry.
Okay, thank you, Liz. So what do I do? Can you give me a scope of work or some basic steps on how I can complete this security risk analysis?
Sure. And now this is, in general, this is how you go about a process like this. You need to assess what needs to be done and implement solutions. You need to make sure that your policies and your processes are reasonable and appropriate. And boy, that can get sticky, okay, because it's subject to some interpretation. You know that some are required, but some of those measures or those requirements you have some flexibility with. So you have to be reasonable and appropriate. You might want a second opinion on this. Ensure that the confidentiality, integrity, and availability of each EPHI is maintained, and then make sure that you analyze when you create, receive, maintain, or transmit any PHI. So you have to go through the scope of all of these pieces to manage the entire security risk assessment. Let's look at some steps, Selena. So first, you're going to define the scope of the security risk analysis. This may be just one location. There may be multiple locations. You may be working with one individual in each location. You may have a team doing this, and you may have a specific template that you're using. I hope to goodness you are. So define the scope of your security risk analysis, looking at those steps that we just looked at. Do an inventory of your EPHI systems. Kelly just mentioned this. So I recommend that whenever you have serial numbers available for any software or hardware, that you list those. Remember that one of the reasons that we do this is if something happens to that equipment, so to speak, that hardware, that you'll be able to know where EPHI was located. If your office gets broken into and they throw 50, well, that might be an exaggeration, 20 screens on top of a desk or 20 laptops on a desk on a floor, it might be hard to determine whose is whose. So we say to list all hardware, all the software that contains EPHI. Think about some of your specialists. Think about some of those devices or that equipment that you have that has software in it. Don't forget those photocopiers, folks. They've got memory in them, and so they have EPHI in them. So make an inventory, comprehensive. And if your IT company says they have this, then please take a look at it. It probably doesn't include some of your medical equipment, and it may not include, just may not include all of the information that needs to be on it as far as software is concerned. or copiers for that matter. So then you need to assess your current security measures and review past security risk assessment reports and make sure that you've made the updates in the past that you said you needed to make to mitigate concerns in the past. Okay. Many of y'all may do these and not fix those. We're going to talk about that in a minute, but you need to go back. If you've got something hanging out there from 2 years ago, you need to fix it. Because if you have an audit and they find that, your fine's going to be larger, because that means you just willfully neglected fixing that for 2 years. Make sure you identify your risk, use what you know, use your co-workers, and use the tools that are available to you. Determine the likelihood of a threat. Is it likely something is going to happen, or is it not likely? It's subjective, folks. What do you think? Document your findings. You know, in the government, if it's not documented, it didn't happen. Document your findings. Make sure that you've got a security risk assessment report and that it has mitigation steps in it. I've seen practices. I saw a practice that spent several thousand, tens of thousands of dollars for a consultant to do their security risk assessment, ended up with a 50-something page executive summary and failed their at the time it was a meaningful use audit, because the auditors couldn't find, in those 50-something pages, they could not find the mitigation plan with dates. They were given the opportunity to fix it, and that's okay. It ended up getting them over $150,000 in incentive that year, but that's a bad feeling. So even professionals can do things that the government doesn't want to see. Present reports to those who need to know, because everybody can be impacted by different pieces of the security risk assessment, and then create an action mitigation plan to reduce your highest risk. Put a date that you plan to have that action taken care of or that risk mitigated, and don't make that date 6 months to a year out, please.
Thank you, Liz. That was some great information, very important information that we need to take and put it somewhere and store it in our brain to remember that we need to do this every year. And coming up to this question, do I really have to do this every year?
Yeah, you got to think of this as a program. That's why folks have compliance programs. It's not a project. So compliance is really just about process. Do you have a process? Is it the right process? And are you doing it? And like Liz said, the only way you know, according to the government, whether it's been done or not, is if it's written down. So as part of your compliance program, you need to have a record that shows you looked at your risks at least every year, and that you've done an analysis of how likely those risks are, what the impact to your organization would be if that risk occurred, and then that you came up with a plan. So you do the assessment, you do writing, and then you're going to have a plan that's your compliance plan each year for how you're going to meet these risks or make sure you continue to improve. So I was at a Healthcare Compliance Association meeting in Boston this summer, and the CMS folks were very clear that they are looking to see that people are taking compliance seriously and that they're investing in their program. So you got to think of it as a program. This is not a standalone issue.
Which is the way that we need to work on it. So that means we have ongoing activities when we look at it as a program rather than a project that ends every year, because it keeps on ticking. So to comply with HIPAA, you have to continue to review, correct, and modify, as well as update your security protections. Although you do not need to do a full security risk analysis every year. Please, please be careful. If you're using a template, do not overwrite the previous year. Remember, you got to save these, each of them, for 6 years. You must review and update your analysis at least each year, or when you make changes to your practice or to your EHR or some other electronic system that handles EPHI. Anytime there is a change, then you need to document that change in your security risk analysis. Remember, documentation is key, as Kelly said. Under the Promoting Interoperability programs, both Medicaid and MIPS, providers must review their risk assessment each EHR reporting period, or before they report at the end of that year. So in other words, in the calendar year, you've got to do that risk analysis or the review of your existing risk analysis and update it and update your mitigation plan. You should correct any deficiencies identified in the risk analysis during the reporting period as part of your risk management program. If you're doing that risk analysis on December 31st, and I know y'all are out there because I've done them with you, if you're doing it on December 31st, then obviously you wouldn't be able to get everything mitigated by the end of the year. And that is okay, but don't date it out to June. Set all the rest of those things that need to be mitigated to be handled within the first quarter of the next year if you're doing that in December. But anything you can get done as soon as possible. Because once you know, then you're even more responsible for getting it fixed.
Adding to what Liz just said, I always love it if we know there's going to be a change in software or vendor or anything like that, to go ahead and make sure your risk analysis is dated before that happens, and then we do it again right after the change, and now you've got two to show you took this seriously and that you did it. Sometimes folks will use any excuse to delay, and they'll be like, there's a change coming up, I'll just wait and do it after. You really need to get it done before so you have a baseline to measure against. All right, so this here is a common confusion. And Liz at the very beginning, it's the security risk analysis, there's an assessment, there's a compliance thing, and what I'm just going to do in these next couple of slides is show you where in the rules you can find exactly what the feds are looking for these different components of your program, because I think people get confused. So in April 2018, so you know, the Office of Civil Rights does a cybersecurity newsletter. It comes out many times each year, and whoever is handling security, and honestly privacy and security for your practice, it would make sense for them to at least go online and look at that. But the OCR explained that a gap analysis is great and helpful in identifying problems in security, but that it's not a security risk assessment. And I think what people do is that's something they can figure out. They can see where maybe they're not hitting the mark they want or what they think they need to be doing. But it's not enough to issue spot, right? You have to actually say, okay, here are the issues. Really, how serious an issue is this? Is it likely? Is it going to have a big impact on us if it actually comes to fruition? And how can we fix it? Those other pieces are crucial. That's what makes it a security risk assessment versus just a gap analysis. So this first one here, you have to each year complete a HIPAA security risk analysis or assessment. That's the section. You're asking yourself, what is the exposure to our electronic PHI, and how can we mitigate the risk? This is not the same thing as looking at your compliance program. That's where you're saying, okay, do we have the right policies and procedures in place? Are we actually complying with the security rule? You should be reviewing your policies and procedures every year, but just looking at your policies and procedures is not going to meet the security risk assessment requirements. Next. You have to do technical testing of your environment. This is where you're saying, okay, are our technical safeguards sufficient, our technical controls? In other words, we know that we have firewalls. Has that firewall been tested? And usually you're going to be doing this on the security, on a calendar. I use Excel for all kinds of things, but you could write it on a kitten calendar. It really doesn't matter. That the first Friday of every month, someone goes back and tests your firewall and makes sure it's there. Someone confirms and writes it down that all of your computers have downloaded the virus updates. You also are needing to make sure that your rules, your privacy rules and policies are in place. That's another annual thing. Do we have all our policies in place, and has someone checked? This is something you need to be doing, and it says it right there in the regulations. But again, it's not a security risk assessment. And the same thing with the breach. Do you have a breach rule policy in place? Are you following that policy? And is someone confirming? So I just want to emphasize that this is an important piece of the program, but it's not the only piece of the program. And doing these other pieces that are sometimes easier and that you can outsource to your privacy officer are not, you can't do them in place of the security risk analysis. Again, this is just explaining the evaluation and where the standard is. You'll remember I showed you at the very beginning in that sheet from CMS where it said the security risk analysis was required. This bottom here is the actual standard that's cited there that explains that you're doing an evaluation and what it is.
Okay, Liz. In my experience in working with some of the providers for the Medicaid Incentive Program, I know they've made common mistakes like putting the date in the wrong place on the Excel sheet. Can you go over a few common mistakes in conducting an SRA, please, Liz?
Sure. So we got a lot of failing here. So obviously these are common failings. So failing to quantify the impact of a security failure. So this is something that's a little bit beyond just doing this template for your security risk assessment. This is understanding what a security failure would cost the practice. And the reason that this is important is because this is what HHS, this is what they expect you, this is how they expect you to analyze risk, okay? They expect you to quantify risk by how much it would cost the practice if it occurred. Okay, common mistakes, and Selena, I know we've had this problem a good deal in the last few years with our Medicaid risk assessments, that they weren't addressing all three aspects of the HIPAA security. So they weren't addressing all three safeguards of administrative, physical, and technical, and you have to address those. You don't have to call on those specific words, but you have to, it has to indicate that you're addressing those three aspects. You have to look beyond your internal systems. It's not just, for instance, some of you may do a risk assessment and you may report on there that your backup is no problem because you're using a co-location, you're backing up to a location, co-location, so everything's good. But everything might not be good on that on that external system. What are their compliance regulations? Are they fully meeting all the HIPAA requirements? Because if they're not, it could impact you. So you have to look at what others are doing outside your internal systems, because that could impact your viability. Failing to address security as well as the security rule. Folks, I know this seems like a very simple statement, but I got to tell you that perhaps as many as 50% of the small practices that I work with, those are under 15 and under, aren't really addressing security, okay? And that's the fact. Even when we do risk assessments, many of you still don't go in and address security effectively, and you are incredibly vulnerable. Failing to test, Kelly just mentioned, and whenever I work on, I know either one of us are working with folks on their security risk assessments, and Selena as well, that we talk about. One of the questions is, have you tested? Oh yeah, our backup works. Oh really, have you tested it? Well, no. Well, if you haven't tested it, how do you know your backup works? And what are you going to do if it doesn't? So that's an important question. Failing to develop a mitigation plan with dates. This is the biggest reason that folks failed meaningful use audits. Failing to develop not anything on meaningful use, and it's not going to be the things on promoting interoperability. It's not going to be those measures. 75% of the time, it's going to be that the security risk assessment is not documented properly. There's no mitigation plan with dates, and you will fail an audit for promoting interoperability now. And then, of course, failing to mitigate something. So if you see you've got a problem, and a year later you still got the problem, and then you get audited 4 months later, you still hadn't fixed that problem, that's a bigger problem than you know. So if you find you have an issue, fix the issue.
Okay, our next question is, do we have to follow all of the NIST standards?
Basically, no. But I just want to make sure folks are aware that NIST exists. I mean, if you're a small physician practice, some of this is going to sound new to you. But you should know that the National Institute of Standards and Technology, NIST, has been in existence way longer than this HIPAA security rule regulatory framework we're dealing with. They didn't create the idea of security, CMS didn't create the idea of a security risk assessment. Okay, that's already been part of computer security for a long time. The idea of physical, administrative, and technical controls, that whole information security arena is a thing. It's already been there. What's difficult is that because of the way HIPAA has been worded and the security rule requirements, now providers are having to familiarize themselves with this information technology framework that's just completely foreign to them. When I started practicing law, it was foreign to me too. I mean, this is not something you grow up knowing. So I want you to know that there are NIST standards. They are not necessarily expecting physician practices to follow these. However, because NIST is sort of the framework that large technical institutions follow, if you are a larger institution, it would do you well to look at it. For example, if you're an FQHC with 33 practices, you're a hospital system, you're a vendor, they're going to be looking to see how you're handling things. The Office of Civil Rights has released a crosswalk. It's on their website that shows how the NIST standards maps onto the HIPAA security rule requirements that I showed you earlier. Now, they also tell you how other frameworks work, but you do not see them in presentations presenting about other frameworks. It's mainly useful for the NIST standards. Here's a nice thing about it, though. If you are having trouble figuring out how to get started and doing your initial step of that security analysis, your gap analysis, what should we be doing? The NIST standards and framework is much more detailed than what CMS has put out. So sometimes it is useful when you're talking with your IT folks saying, okay, how do we handle and go through those specific steps as part of your analysis, because it is helpful. The specific guidance, it's a publication which is free and available online that the OCR's put out that kind of says how you could meet the risk analysis requirements using the NIST publication. But, you know, another thing I'll say is y'all may recall, you've heard of the Anthem breach. This was, of course, dealing with a large insurance company. They had a lot of information that got shared. It was a $16 million settlement. It came out last October. But what they found, the reason there's a settlement is they found risk analysis failures in insufficient reviews of system activity. When they looked at the system activity and how that Anthem handled stuff, it wasn't just based on the security rule. They were looking more broadly at how information technology would analyze this. And they found that there was insufficient technical controls to prevent unauthorized ePHI access. The NIST standards just help you see what technical controls and things like that you should have in place. So the answer is no, but it's helpful guidance that will not hurt you if you are adding it to your analysis.
Thank you, Kelly. So Liz, are there any good tools that's available to help us with the to use the CMS? Do we have to use the CMS tool? Do you have something you provide, or do we go to the ONC website? Can you give us some examples of some kind of tools that are available for the security risk analysis?
Sure, Selena. I don't know if I can say if any good tools, but I can say there are many tools. So there is a spreadsheet version of that the ONC provided for us several years ago. It is complicated to learn. The reason I say that is because it has macros. So if you're used to using Excel and macros, this will not be too complicated for you. If you're not used to using Excel, then it's a burden. But once you've filled it out, then it is very easy to maintain and update. It's not as detailed, so you won't learn as much as when you do this as you will if you did the very long one on the CMS site. That one's very comprehensive and does a great job of educating you. So my recommendation is if you have to do this yourself, then the first time at least do the one that's on the federal site, because those painful, repetitive questions help you learn what it is you're supposed to be doing. If you're a pro and you just need a good template for doing the assessment and having your mitigation plan put together, then you can use that spreadsheet version, and we'll be glad to share that with you folks. Okay. There are many vendors who have tools available. The one that I just mentioned, the spreadsheet, is a free tool. The one that's on the ONC site, the one on healthit.gov, that is a free tool. Many vendors have tools available, but they are not free. The pricing we find ranges from about $3,500 to $20,000 for a small to 15 provider practice, so to speak. And after that, it's who knows. It gets very expensive sometimes. There are many consultants that do this that have their own tools. I know folks like Kelly has her own tool. So there are many tools available for you, but basically the only two free ones that I know of are the one that CMS provided for us and the one that's on the healthit.gov website are the only free ones that I know of. There were some available in books where you could buy a book with a manual and a disc with a tool on it. But the few people that tried to use that a few years ago found it not to be a good solution. So yes, there are tools, whether they're good or not, that's another question. But there are many organizations that have tools that for a price would be available to help you. And on that, I just have to say to you guys, because I have many providers tell me, oh, I can't afford $3,500 for somebody to do this every year. And I'm talking your training, your risk assessment, your manual, all of these things. And I usually tease them about, yeah, because that would cut into your new BMW payment for this year. But I would like for you to consider that, you know, if it costs you $3,500 a year, how much is that a month? And is that worth your peace of mind? That's what I need for you to consider. Is $300 to $500 a month or less worth your peace of mind? And what else are you paying that kind of money for peace of mind? So sorry, I'll get off my soapbox, but man, this may be our biggest problem area out there is the security risk assessment and HIPAA. Okay, next slide. Oh, yeah, sorry, Kelly.
No, I just want to jump in real quick on that. The one thing I want to say is sometimes folks have the idea that if they can just find the right tool, then it will be like a safe harbor and they will be guaranteed, their security risk analysis will be guaranteed. No tool, including CMS's tool, is a safe harbor, meaning you can't, filling it out and answering every field does not mean that you're guaranteed that you have done your risk analysis. However, if you are making a solid effort to, on a routine basis, go through those steps and look at your risk and act on it, no matter how you're writing it down. I wouldn't put it on a yellow legal pad because that probably doesn't have quite the gravitas you're looking for. But you can put it on a spreadsheet. You can put it in a Word document. You just have to make sure you're doing the real work. You're going to at least show that you are attempting to be compliant. And, you know, under HIPAA, so if you are showing that you are willfully neglecting your requirements, you just haven't done it, or you're ignoring it, there are fines that no one can negotiate your way out of. But so long as you're doing the work, and I know Liz had on her slide that the tool, you're going to be doing the same work no matter what tool you're using. What's important is that you do the work. There's no tool that's going to, you know, unfortunately, magically make that work less. So, thanks.
Okay. Thank you, Kelly and Liz. So, Kelly, what if I have multiple practices or different hospitals that I'm doing security risk analysis for? If I do it for that one location, would that be sufficient?
No, we can't extrapolate from one location to all. At a minimum, we need to have someone looking at each site and doing a gap analysis there to make sure that every site's risks are included in our assessment. You know, what I usually find is some sites are newer than others. They may have different physical controls in place. But you can use one assessment and just mention in your fields the concerns for different places. For example, there might be a query about physical controls, and you say, we handle this at South Office through that alarm system and these deadbolt locks, and everyone has a security tag that they use to get in. We handle this at North Office, that alarm system, everyone has a separate code. Okay. Now, some things are going to be the same for both offices. Your EMR is likely going to be across both. Your policies and procedures will be across both. But you do have to actually look at the risks and the controls that are in place at each site.
Okay. Thank you. Okay. Our next question is, what is the difference between low, medium, and high risk? Can you give us an explanation of low, medium, and high risk? What exactly does that mean?
Well, Selena, I guess the timing is good on this because we don't have much time for me to go over that, and that's a good thing because we do need to speed it up. But the risk association, whether you feel it's low, medium, or high, is subjective. You have to answer this. So it's what you think, what you believe. As I've mentioned multiple times already today, they're looking for the financial impact, the dollar amount, okay? So if something if something like your business associate agreements aren't in place, and that could impact, for instance, with your EHR vendor, and that could impact every patient's record that you've got in your EHR, and you could pay a fine for that, well, that's a pretty high impact, and so that would be a high risk. But again, it's subjective. So you have to consider the vulnerability, the exposure, and the potential cost to determine your risk.
Okay. Thank you. Okay, so are there resources out there for our employees? How do we keep our employees up to date with HIPAA and privacy breaches? Is there, for small practices or hospitals, is there training that provides this for us?
Well, this is up to the individual organization. Hospitals will have should have their own compliance organization that does the training for their employees, and the security officer for each practice should be in charge of training. And so you would do a comprehensive training. It's required to do it every year, and every staff member needs to participate, sign that they've participated, understand and will follow what they've learned. You need to put reminders in your break rooms or in your kitchen. You need to you need to make sure everybody's aware of your sanctions. You need to send you need to send out reminders, electronic reminders periodically. So this is up to you in the practice and the security officer to do the reminding, and to do the training, and then remind at least once a month for everyone to stay cognizant or to be aware of HIPAA or of security.
Okay. Thank you, Liz. So Kelly, this is a question for you. Is HIPAA going to go away? Is it going to change? Is the requirements going to change? Is there any reprieve? What kind of feedback, or how can you answer this for our practices that are worried, or the physicians and the administrative staff regarding security risk analysis and HIPAA requirements?
Yeah, no, it's not going to change. The security rule has required an analysis since the very beginning in HIPAA. It's been a big part of the HITEC Act and the regulations. It's not going to change. But more specifically, this summer, I was able to have a conversation with folks at HHS, and they made it very clear that under the current administration, they had been asked to clarify various healthcare regulations. But there is no intent to change anything about HIPAA. Actually, the protecting patient records has wide nonpartisan support. Both sides of the aisle think that protecting patient records and requiring providers to maintain security of those records is important. So no, there's not expected to be any change.
Thank you. Okay, so we know we're kind of pushed for time here, and Liz and I will kind of elaborate on this answer, this particular question, this particular slide. How can the security risk assessment impact MIPS? and also the Medicaid Incentive Program. We both know that it is a requirement. It's the first objective. You must meet all the measures or you can't attest. So unfortunately, that's something that has to be done. As Liz and Kelly has gone through the slides, you must do a mitigation plan. It must be done once a year. It's a requirement. Liz, would you like to kind of piggyback on and give some more information on how it can impact and why it is so important to make sure this is done every year?
Well, in addition to the HIPAA requirement, which to me is the showstopper, but in addition to that, if you don't do the security risk assessment, you will not pass the Medicaid Promoting Interoperability Incentive Program for the year. And on the MIP side, you'll lose 25%. But something else I want to bring to the attention, if we could change the slide, I want to bring to the attention to folks that are participating in the MIPS program. And that is that CMS has announced that they're now doing MIPS audits. And so they're going to be looking at these security risk assessments. We believe we don't have the details. We've been told they're going to start in August. But you best make sure those risk assessments were in good shape, or I hope they were, and that you have them for the last 2 years of MIPS, because those audits for 2017 are going to begin, are scheduled to begin next month. So don't mess around with that.
Okay. Do we have a security officer? Every practice should have a designated security officer in their practice. It could be your practice manager or whoever, any other administrative staff. And it must be documented. Security officers specified in HIPAA training should be done in your practice every year, listed in your SRA, and registered with HARP.
Right. So those are some functions that we want those security officers to do. That listed within the SR listed. You need to list the security officer's name and title in your manual, in your training, and in your security risk assessment. It should be all three of those places. But the answer is, to net it out, yes, you should have a security officer. Every practice should have a security officer.
That is something, though, that you can delegate to an IT vendor. You can hire a consultant and have them be your security officer, or you can have someone in the practice manager, whoever's your privacy officer, also do it. But they would still need to be working with whoever's helping you with IT.
Very good. Thank you, Kelly.
Thanks, Kelly. Do we have to get business association agreements signed every year?
You don't. What you need is a business associate agreement in place whenever a services agreement is in place that gives that a business associate access to your PHI. So if you're leasing a copier and that copier's got a hard drive in it, they all do, folks, and you're copying records on that, then you need to make sure you have a business associate agreement in place the entire length of that copier lease. So my preference is to actually have the business associate agreements tied to the vendor agreement, so that you're better able to know, hey, if I signed this vendor agreement, we wouldn't have signed it unless we already had the business associate agreement or we signed it simultaneously. But you would still need to confirm by checking your business associate inventory each year that you have a copy of that agreement. If your practice manager keeps all the vendor contracts, that's great. But I would still, with your compliance stuff, have a copy of every business associate agreement as well. So you might have 2 copies of the same agreement, but you don't want to be having to go ask someone to help you find it if you get an audit.
Thanks, Kelly. So here are some frequently asked questions.
This is the speed round.
Okay. So you want to go first, Liz? Let's see. Okay. Can you clarify what type of corrective action plan you are referring to?
Okay. So this is one of the questions that came in for the registration. We're not exactly sure what they were referring to. What we believe they're talking about is our mitigation plan that has corrective actions to mitigate the risk. So I believe we're talking about the mitigation plan for corrective action, and it must have dates when you plan to have that correction completed.
Okay. What should I include in my inventory list? How detailed should it be?
Oh, we already did that one.
Okay, so we answered that one. We have limited IT resources. How do we know if it's time to outsource the security risk analysis?
As soon as you can afford it. Kelly, I'll let you. I'm sorry, Kelly. What did you want to add to that? I'm sorry.
Do you have one? I mean, if you don't have one, then you can't afford to be without it. So, if you need help getting it done, then I would get it done, however it takes.
And I think the next question, we kind of elaborated on that too. What can I ask my EHR vendor to provide to help me complete my security risk analysis? And I think they mentioned that even if you get your IT person or your EHR vendor, at the end of the day, you're still responsible for what is put into that security risk analysis. And Liz and Kelly, I don't know if you want to elaborate on that more,
Well,
but I think
you can certainly get them to give you your network layout. They typically can give you the names of your firewall and your viruses and those types. They can give you the configuration, so they can give you information that pertains to your hardware. And perhaps your Microsoft and some of your basic software, but probably not your EHR or your policies. Kelly, anything else?
I just like to make sure that in every IT agreement that y'all are requiring your IT vendor to update you or let you know as soon as they notice any problem, and that they agree in that contract to check your firewalls and to update your patches and things like that on a schedule, because those scheduled dates will go into your security risk analysis. And you'll of course have to check up that they're doing that by asking them. But if you have a contract in place, that's something you can use as an exhibit to show how you've tried to meet those requirements.
Okay, thank you, Kelly. I have heard that people in my practice need to be trained as the first line of defense. What is the best way to ensure the training is effective?
Okay. So the first thing to do is to make sure you're doing the training. And there are lots of modules for training available. Your package, if you use an external consultant or IT company, they may have a training package that they use, or you can maybe get one simple to use in-house. Make sure you're doing the training and everybody's staying awake during the training, and then making sure that you're reminding them. And then the sanctions, folks, go over the sanctions, 3 strikes and you're gone. So sanctions often have a major effect on how well your staff is trained.
Okay, so that goes into how do you train employees? I think you kind of answered that. Is anything else you want to add to that? How do you train employees on common threats?
No, they should be common threats should be part of your training slides.
Okay, thank you.
The only thing is make sure you have everyone sign in to every training. You either need to be getting a certificate from an online training that's going to ask them questions. If it's an in-person training, just make sure you have everyone sign in so you can prove that you trained your folks.
Okay, thank you. How often should I check audit logs?
Well, this is going to depend to some extent on what resources you have in place. So most EMRs should have the ability to do an audit log. I know some of them you have to actually ask the vendor to do them. Athena, you need to ask the vendor to do the log, but you can request it and they'll do it for you going back however much you want. Had a client do that this past year, first time they finally checked their audit logs, and sure enough, they had an employee logging in from home every day, downloading things. So first off, let's make sure you're actually checking your audit logs. I'd say 90% of my folks aren't doing that on a regular basis. And then I'd look and say, okay, how frequently can I do that? I think it needs to be done at least quarterly, some sort of random thing quarterly. But that's a best practice. It's not that there's a requirement.
Okay. And I know some of the big, from experience, I know some of the big EHR vendors like Epic, that's something that they're monitoring all the time. So if you go in there, and sign into somebody, it automatically gives them an alert. And this is something I know from experience. So if you go into a family member's chart and you work in that provider's office, they're gonna get notice of that right away. So obviously they're checking theirs on a daily basis. So the next question is, what is the latest and most recent updates from MD offices for HIPAA compliance?
You got it. The old is forever new.
Yeah. Okay, so what considerations need to be included if the EHR vendor is used by multiple practices?
The main thing I'll say is it doesn't work as a defense. Well, we do 100 practices are used to doing it this way.
Okay.
I get that sometimes. I'm like, well, why do your administrative folks have access to these, mental health records or whatever, if that's not a role-based control, if that role doesn't really require that access? And saying, well, it's just easier for our 100 practices is not going to be an adequate defense. So you are going to have to look and see what is best for that specific circumstance. I mean, it's still HIPAA. You're still having to meet the minimum necessary requirement, making sure folks are only getting the information they need to perform their role. But you do want to make sure that you're checking audits so that, if it's possible in your EHR to limit folks from one practice site going into records of another place, that's fine. But otherwise that you're just auditing if everyone at those 100 practices or in that HIE, for that matter, have access to information.
Okay. So our last question here is, what specific API questions for portal access are proposed?
Okay, I'm going to take that one because we don't have any specific API questions proposed for portal access at this time. We do know that there are specifications that APIs must follow, and we also know that portals have very heavy specifications for access and for identity access and control, but we don't have any specifics on this at this time.
Thank you, Liz.
Okay, this was just the reminders of that what you got to do. We don't really have time to repeat everything. We've already said this multiple times, and it's in big bold print. So do it. Okay. Next slide.
But do keep a copy.
Oh yeah, do keep.
Make sure you have it for 7 years.
Yeah. And of course, this is just our joke. Okay. Next slide. That might be what we feel like. Okay. Just kidding.
Okay.
I'm the one in the middle. Okay.
Oh, went back too far.
So
So we know we're pushed for time, and here are some of the resources, and we know that the security risk analysis, that's a very broad topic, and unfortunately we probably couldn't cover everything within an hour, but there's resources, and we here at Georgia HITEC is available for you. You will also get a copy of this presentation.